As today, more than 20,000 health professionals have completed the core elements of that training, which is an online training program funded by the department and administered by the Australian College of Nursing on our behalf. More than 12,500 have completed the Pfizer module, which is focused particularly on the special details required for Pfizer. We know it has some cold chain requirements and some special actions required in relation to drawing up. And of course now we have a module focused on AstraZeneca, which is the program to be commenced tomorrow in Western Australia and in South Australia. And almost 13,000 health professionals have completed the specialised training in AstraZeneca. So I'm happy to take any questions.
Professor McMillan, based on our current trajectory with the vaccine rollout, are you still confident that we'll hit our targets by October?
Yes, we are. We knew that this rollout would take a number of steps, and as you know, it had different stages in it, 1A, 1B, and that was always a role. As the vaccine becomes available, we'll see increased numbers over time, but we still focused on that October deadline.
And you've said 13,000 or so health staff have conducted the training for the AstraZeneca vaccine to date. How many overall are you hoping to complete that training?
We don't have an upper limit. The training is available to all health professionals to complete, and so it's in our best interest that everyone is familiar with this. So we want, certainly there's a requirement that anyone who administers the vaccine has completed the training, but we're happy for any health professional to complete it.
And so did you say it was WA and South Australia starting tomorrow?
That's my understanding.
Yeah,
yes.
So when will the other states start? Do you know?
As the logistics rolls out, the others will start. I don't have details on when those will be yet, but obviously that's starting now and will come in subsequent days.
All right. And look, ads published today or published this week in newspapers by Clive Palmer have raised doubts about the safety of the vaccine rollout. Do you think that ads like that might risk undermining public confidence at all?
Let me restate to everyone the really important message we want to say. These vaccines went through the formal process that Australia always takes to ensure these vaccines are safe and effective. It wasn't rushed. It went through the proper process, and we took our time to make sure that was done. So everyone can have confidence in the safe and effectiveness of these vaccines. Commentary elsewhere I will leave to others, but from me as the Chief Nurse and Midwife, I give you my reassurance that we've gone through a proper and due process on these vaccines.
And in terms of the AstraZeneca vaccines, we're obviously making about 50 million locally in Melbourne. Do you have any idea of the rollout timeframe for those vaccines yet?
That detail I don't have. No, I think that we're using currently that's come from overseas with an aim as our vaccine becomes ready. When it's prepared, then we will start introducing our local version as well.
And do you think when those are approved, our vaccine the rollout, do you think the rate will accelerate once we've got that extra production?
I think we will, because we'll have more available and we'll be going to bigger populations. As I said before, at this point in time, we've definitely focused on those most vulnerable, those in aged care and those providing our frontline protection through quarantine, and as we go to bigger populations with bigger hubs, we'll see bigger numbers increase. Yeah.
And we've also seen the Australian Defence Force is going to be helping with the rollout as of next week. Are you able to give us any more details about what they will be doing? That's still being worked with the Defence Force. They are Defence Force health personnel who have been freed up to be a part of our response. States and territories are working with the Defence Force on how best to use that fantastic resource that we love to work with, but that's being worked through at a local level.